keep it in this mode?
If you think that's easiest,
Yeah.
it's okay. Because I know this is a little bit of a bear just with Canva, but it looks really good.
Thank you.
We usually give folks a few minutes to trickle in before we kick things off.
Kind of the downside of the webinar is I think it just takes time. It's kind of strange, but here they come, which is great.
Yay.
I feel like this whole Canva presentation mode is probably more suited for people with double screens.
Okay. I struggle with that too. If I share my screen and it's double, I don't really know what to do with myself.
Right.
Yeah. So much technology.
Well, we'll get started. I know that folks will continue to join us, and welcome. Thanks for being a part of our Gynecologic Cancer webinar series for our third Wednesday in a row. For those of you who may not know, we started off the beginning of the month with updates in gynecologic cancers, the medical treatment with Dr. Angel. Last week, we had long-term effects of chemotherapy and radiation in gynecologic cancers with Nicole Rubin. Both of those recordings are available on our website, and we will throw the link into the chat. Today, I'm really excited for the third installation of this webinar series, and we're really focusing, as the slide says, sexual health before and after gynecologic cancer treatment. This is a really fascinating topic, and I'm so glad that we have everyone here today, a great panel. Just a few housekeeping things from me. I'm Kristina Thompson, Director of the Breast Cancer Coalition. For 10 years now, we've been serving folks with gynecologic cancer, and I'm really happy this month to be highlighting all of these opportunities. There are closed captions available. If you need them at the bottom of your screen, you can enable them. This is being recorded and will be uploaded on our website later today. Any questions that come into the chat, we're going to actually save for next Wednesday evening at 7 p.m., where Kristina will join us again, as well as Dr. Angel and Dr. Rubin for a panel Q&A, as well as hearing from some survivor speakers. So be sure to join us for that. And now I'm going to turn it over to Rachel Rosen-Simpson, our program manager.
Welcome, everyone. Thanks for spending another lunch hour with us during this webinar series. For those who have not tuned in until now, which I hope you have tuned in the previous Wednesdays, because it's been really excellent. But I took over as program manager August 1st. I had a few weeks to hit the ground running and get this put together. It's been an honor to be in this role. I hope everybody will be able to join us for the Q&A next week. As Kristina said, we'll keep an eye on the chat and make sure we take all of those questions to share with the presenters next week. Once again, it will be recorded. So even if you can't make it next week, please share all your questions with us and we will make sure that they get asked and answered. I suppose that's enough housekeeping overall. So without further ado, we have three amazing providers with us today to focus on sexual health before and after gynecologic cancer treatment. This issue is very important to me. I think it's easy in the process of diagnosis, treatment, wherever you are in this continuum, to start to feel more like a patient and less like a person. And these amazing providers are helping to focus on survivorship and what it means to be a whole person and to get holistic treatment and holistic support. Your sexual health is part of your health. So without further ado, I'm going to pass the torch and tune in for this amazing presentation. Thank you all for being here with us and sharing this hour.
Hi, everyone. My name's Jocelyn. I'm going to start out here. So before we get started, I just want to put a disclaimer in saying that we acknowledge that not everyone who identifies as a woman has a vulva, and not all individuals with vulvas identify as women. Throughout this presentation, when we reference women or female, we're specifically referring to cisgender women. We also recognize the need for much more research on how aging, menopause, hormonal changes, and cancer affect the sexuality of non-binary and transgender individuals. All right, so the first slide we have here is about the impact of cancer treatment. So here we have the early and late effects of cancer treatment can interfere with physiological systems necessary for the sexual response cycle, body image, intimacy, and relationship dynamics. And basically what this means is that cancer treatments such as surgery, chemotherapy, radiation can cause both short-term and long-term changes in the body that affect a person's ability to engage in sexual activity or feel sexual desire. These treatments can impact the body systems that are needed for sexual arousal and response, such as hormone regulation or nerve function. And additionally, cancer treatment can alter a person's physical appearance, which may affect how they feel about their body image, and influence their self-esteem or confidence in intimate situations. All right. Sorry, it's a little bit slow. There we go. All right. So when we're talking about what does sexual health encompass, sexual health goes beyond just the physical dysfunction, and it involves a complex interaction of psychological factors, social factors, and physical factors. When we're talking about psychological factors, we want to stress mental health, such as stress, anxiety, and depression, which can all impact sexual desire and performance. Self-image, such as body image and self-esteem, which play a crucial role in sexual confidence and satisfaction. Emotional well-being. For social factors, we think about our relationship dynamics, which include partners, communication, intimacy, which all significantly influence sexual health, as well as cultural and social norms. We know that cultural and social norms, their beliefs, can affect sexual attitudes and behaviors. And then finally, the physical factors. So health conditions, chronic illnesses, hormone changes, and physical impairments can directly affect sexual function. In addition, medication and treatments can affect and influence sexual health as well. So how prevalent is female sexual dysfunction? Female sexual dysfunction is common, but it's often underreported. It's an often underreported consequence of cancer treatments, which significantly affects the quality of women and life for women survivors. It can manifest in various ways, including decreased libido, pain during intercourse, difficulties with arousal or orgasm. For breast cancer patients, we see that over 50% of women treated for breast cancer report long-term changes in sexual function. And our focus today on gynecological cancers, an alarming 65 to 90% of women treated for gynecological cancers experience changes in sexual function. These cancers directly involve the reproductive organs, which can lead to significant physical and emotional challenges related to sexual health. And then another important cancer that we cover is colorectal cancer. So more than 60% of women treated for colorectal cancers also report long-term sexual dysfunction. Oops. All right, so this next slide, the most common sexual health concerns. So we see dyspareunia, or pain with intercourse, in about 40 to 100% of patients. This can affect anyone regardless of gender and may be due to a range of factors, including physical, psychological, or medical issues. The pain experienced can vary from mild to severe and occur at any stage of intercourse. Another common sexual health concern is vaginal dryness, and this is reported by 60 to 80% of cancer patients. This condition can significantly impact sexual comfort and pleasure, making intercourse potentially painful and uncomfortable. The next common concern is lack of libido or low desire. Up to 61% of patients experience a lack of libido or sexual desire. This reduction in sexual interest can affect relationship dynamics as well as personal well-being. And then finally, lack of orgasm. Up to 45% of patients report difficulties achieving orgasm, and this can contribute to a decreased sexual satisfaction and may be linked to various underlying factors. So here we have listed specific cancer treatments and their impact on sexual function. Looking at the different portions, we see surgery, chemotherapy, radiation, hormone therapy, as well as other type things. Just give you a moment to view that. So why is this a problem? So this is female sexual dysfunction remains significantly underdiagnosed in the medical practice, with many women hesitating to discuss their concerns due to societal stigma or embarrassment. We know that healthcare providers may not always initiate conversations about further sexual health, which further contributes to sexual dysfunction being overlooked in cancer care and other treatments. Patients may not be properly educated or warned about the potential for female sexual function during treatment planning, which is a really big deal. This statement reflects the findings from a review of 29 studies showing how often female patients are informed about formed and treated for sexual dysfunction, especially in medical contexts such as after treatments or cancer therapy. 28% of female patients recall that a provider led an informed consent of the potential effects on sexual function, such as surgery, chemotherapy, or medications. This suggests that most women, about 72%, were not fully informed about the possible sexual side effects of what they were undergoing. Just 10% of women said they were asked about or evaluated for sexual dysfunction during their follow-up appointments, which means that sexual health concerns were rarely addressed even after treatment. And among the women who experienced sexual dysfunction, only 22% were given any options or treatment to address their concerns. So this indicates even when there are problems identified, most women were not provided necessarily with a solution or care. In summary, the findings suggest that female sexual dysfunction is often overlooked, with very few women being informed, assessed, or treated in the healthcare setting, which leaves many women without support and a major issue that could affect their quality of life. So why isn't this being addressed? And there's a number of factors having to do with this. Oftentimes, there could be a lack of training and a gap in education for providers. Some providers, about 45%, avoid discussing sexual function when they believe the patient is too ill, assuming sexual health is not a priority in these cases. Another issue could be the demands of cancer care often leave little room to address non-life-threatening issues like sexual health, making it a lower priority during consultations. And also, there could be misconceptions. Some providers may assume that patients, especially older individuals, single individuals, or those with a serious illness, are not sexually active or interested in sexual health, leading to missed opportunities for discussion and care. Our next topic is patient barriers. So only about 14% of patients ask their healthcare providers about sexual concerns, which highlights the needs for proactive provider engagement. Some people may feel reluctant to bring up sexual health due to the embarrassment or feel of being judged or stigmatized. And this can be especially true for patients who are not cisgender or those who do not engage in heterosexual penetrative intercourse, as they may face additional concerns around acceptance. Cultural beliefs may cause patients to view sexual health as a taboo topic, leading to discomfort in discussing it with their providers. And as providers, we need to be sensitive to these factors and create an open space for open communication. And then some patients assume that there's no treatment options available for their sexual concerns, particularly if a healthcare provider has never addressed or offered a solution. So this really underscores the importance of educating patients about the available resources and treatment options, and is a call to action for providers that we should be aware of these patient barriers and take a proactive role in initiating discussions about sexual health. Things we're going to address today. We're going to talk about the anatomy basics. We're going to talk about dyspareunia, vaginal dryness, dilator therapy, using a vibrator, benefits and uses of pelvic physical therapy, and then occupational therapy for sexual wellness. So this is a slide that we wanted to talk about showing the difference between the vulva versus the vagina. So the vulva is an external portion, whereas the vagina is the internal vaginal canal. And we'll talk about more of this in detail further in the presentation. This is another important slide. This is important because I think we often overlook how similar the clitoris is to the penis. So when we're talking about the clitoris versus the penis, they're both homologous organs, meaning they develop from the same embryonic tissue, but they have different roles in sexual function and anatomy. Both organs contain erectile tissue, which can become engorged with blood during sexual arousal, and both play a significant role in sexual pleasure due to their high concentration of nerve endings. The clitoris is much smaller and located above the vaginal opening, just under the pubic bone. The external part, which is the glans, and you can see that right, the purple section, this is the most visible, but the majority of the clitoral structure is internal, with two long legs that extend deeply into the body. As we discussed, its main function is sexual pleasure. It's densely packed with about 8,000 nerve endings. Unlike the penis, though, it does not have a reproductive function. In summary, while the clitoris and penis share some similarities, the roles and function differ. As we said, with the clitoris primarily serving as a sexual pleasure and the penis serving as both reproductive and urinary functions. So I apologize, it's a little delayed. All right, so this is what we talked about, the clitoris, and now I'm going to hand it over to Carli.
Hi, I'm Carli. I'm going to take over and start off by talking about dyspareunia, which is a term that means pain during intercourse. So this can include pain for any reason, some of which are listed here. Some types of cancer and their treatments can directly or indirectly contribute to this pain by causing changes in genital anatomy, function, and sensation, which I'll explain more in the next few slides. This diagram is meant to give an overview of the impact of hormonal changes on the vaginal tissue. So on the left side, you can see that before menopause, when estrogen levels are high, we have thick, moist vaginal tissue with good, healthy blood flow. Vaginal walls are elastic and stretchy. We have production of arousal fluid during sexual activity to provide natural lubrication. In comparison, on the right side, we can see changes that occur after menopause or in any low estrogen state. So think medical menopause in response to surgical removal of the ovaries or hormone therapy, which suppresses estrogen levels. So this leads to thin, dry vaginal tissue, decrease in tissue elasticity, narrowing and shortening of the vaginal canal, and decreased ability to produce arousal fluid during sexual activity. All of these changes together can make sexual play and intercourse less comfortable and, in many cases, very painful. So what can happen when painful sex occurs is that it can kick off this cycle of pain. So even a single painful sexual encounter can result in this negative anticipation when thinking about intimacy. So in other words, instead of looking forward to the pleasure of an intimate encounter, there's instead fear that it will result in pain. This results in an involuntary reaction where the body actually tightens the vaginal muscles, which leads to more pain, which thus then continues to reinforce this cycle. So our goal as providers is to help our patients break this cycle, or even better, to prevent that initial inciting pain event from ever occurring in the first place. Vaginismus is a term which you may see that is related to dyspareunia, but this specifically refers to the tightening or spasm of the vaginal muscles, which can occur in response to any type of penetration, which then can cause pain. So focusing a little bit in on vaginal dryness specifically, we saw some of these changes in that earlier slide, but just to reiterate, these are changes that we typically see with menopause or other hormonal changes, including those related to common cancer treatments. So we see this decreased blood flow, thinning of the tissue, and dryness of the tissue. This dryness can cause discomfort and pain with sex, which is a common reason that women bring it to their provider's attention. However, many women also experience symptoms during activities of daily life, including burning, itching, even recurrent urinary tract infections, or general irritation of the vulvar tissue. So while dryness is most often associated with sexual wellness related concerns, it certainly can be bothersome in other ways as well. So this can have a massive negative impact on people. Dryness, which is causing pain or discomfort, can lead to certainly reduced libido and avoidance of intimacy. That can significantly impact relationships, self-esteem, and really overall quality of life. So what can we do about it? Thankfully, there are many ways to manage this, including medical interventions, which I'll discuss next. Physical therapy can be involved as well, and support through community groups, such as the lovely folks here at the Coalition, or in some cases, one-on-one with a counselor or sex therapist. So in discussing care of the genital area, it's helpful to think of three main areas, which each are made up of a unique type of tissue. Number one is the outside skin. So this is the area that's naturally hair covered. That skin is more like the skin on the rest of our body. It doesn't tend to need too much special attention other than using very gentle products. The non-hairy skin on the inner lips of the vulva, that's more delicate, needs more TLC. So really no harsh products there, no scrubbing, no fragrances, just very gentle care, similar to how we would treat the lips on our face. There are times when this thin vulvar tissue can become dry, for example, when using incontinence pads, which tend to wick moisture away from the tissue. In these cases, you can apply a moisture barrier, such as olive oil, coconut oil, or a specialized lotion like Kindra, which moisturizes and protects this delicate tissue. We do caution that coconut oil is meant for external use only. It does have some natural antimicrobial properties which can harm the healthy bacteria inside the vaginal canal that can make some women more prone to yeast infections. So we just avoid using it internally, but externally on the vulva is okay to use and it works well in that area. So vaginal moisturizers are products that are designed to be used internally inside the vagina. These products are designed to improve the baseline level of moisture inside the vaginal canal that provides a lasting effect, as opposed to lubricants, which are meant purely to provide lubrication and comfort during intercourse and sexual play. So to apply these products internally, you can either just use a clean finger or you can use an applicator, which comes with many of the products or can be purchased separately, like from Amazon, for example. We like to warn people that it can cause a very brief stinging sensation at the time of the initial application. And that's caused by the pH adjustment of the skin to the product, and it does subside after a couple weeks of using it. When starting a moisturizer regimen, it's best to use it every day at first, usually at night just before laying down for bed so it stays in place better. And after about 2 weeks, you can then try spacing it out to every other day and then 2 or 3 times a week, depending on the interval that works best for your body to provide that continued relief. Some examples of brands that we recommend are listed here with some pricing info. In our clinic, we have samples of many of these that we provide to our patients so that they can try a few different options before committing to purchasing the full size. One common brand that we do not recommend is Replens. This one can actually pull moisture out of the tissue into the canal, which helps temporarily, but it's actually more drying over time. So that's one to avoid, but the rest of them listed on top are all ones that we trust. So in addition to using the moisturizer on that regular maintenance schedule, we also recommend using a good lubricant when it comes time for intimacy. So there are many, many kinds, as you can see here in this table. And I'm going to focus on 2 main types, which are water-based and silicone-based. Water-based lubricants tend to feel a little more like natural lubrication. They work well, they're easy to clean, they're not as messy as other lubricant types. However, they do absorb into the skin. So the downside is that they don't last as long. Some people find that they need to reapply them, which is not ideal. Some brands that we recommend in this category are listed here along the right-hand side. I just want to note that some of these, such as Astroglide, also make silicone-based lubricants. So you always want to make sure that you're looking closely at the label to know what specifically you're using. Silicone-based lubricants have a bit of a different feel from the water-based. They're very slick and slippery, and they do not absorb into the skin. So the downside of that is that they can feel a little bit messier since they don't absorb, so they can leave your hands feeling slippery. They can be harder to clean from surfaces, but they do provide long-lasting and very effective lubrication. So ultimately, it comes down to personal preference. We typically recommend trying a couple brands of each type. And again, when we see patients in clinic, we try to provide as many samples as possible before people have to go and buy the full size as a trial. So the only thing to remember is that if you're using any silicone devices like dilators or vibrators, which you'll hear more about from Kristina, you'll want to use a water-based lubricant with those because the silicone can degrade the silicone in the device. So just a brief note on hormone replacement therapy. These are medications that contain estrogen or other hormones that are taken either systemically or used topically on the vaginal and vulvar tissue. These are prescription medications that can also be effective for the symptoms that we've reviewed. However, they're not without risks, especially in certain oncology populations. So we recommend that patients interested in learning more about these discuss the risks and benefits directly with their medical provider.
All right, I'm Kristina. I'm going to cover dilators and vibrators. So dilators are really great option, especially for any type of GYN cancers that's been treated, especially with surgery and radiation. We recommend dilator use as long as you can get clearance from your pelvic team, your oncology team, to make sure that you can use them. We can actually do prehab with people before they get radiation treatment to the area for teaching and things like that. And then usually you want to wait several weeks after having radiation therapy to start dilator therapy to see if we can get some stretch back in. Radiation therapy by nature just causes tissues to become more taut and are less elastic. And so if we get pelvic radiation, if they can skip the certain areas that really need that stretch, like the vaginal vault, that'd be great. But in some cancers, they really can't do that. So if they can't do that, our goal is that you can actually get, with dilator use, be able to actually get the stretch and elasticity back to whatever your goal is. We talk about dilator use, we talk about what your goal would be. If your goal is just to have an exam done by your provider, then you want to go for a certain size goal. If you actually want to have penile vaginal intercourse, you actually want to figure out what your goal size is going to be. Using dilators can help to stretch the vagina and keep it flexible. It actually can help with pelvic floor muscle relaxation as well. It can actually help it become too short. That's why they come in different lengths as well. And it can definitely help with those just being more comfortable with getting your exams, which if you've had GYN cancer, getting those exams regularly is going to be pivotal to maintaining your good health. How do I pick up a dilator? So dilators come in different materials. So they come in a rigid plastic or they come in softer silicone. If you can see me, some of them are going to be more flexible. They usually come with a nice texture. They come in either plastic, some are silicone. So you want to see what your materials are made out of. When there are a lot of different brands out there, Intimate Rose is probably a pretty popular one. They do silicone dilators. They range in price. So you've got a really big price range of like $14 to $40. Most of the sets that you'll see on here, including Sole Source, they're going to have different sizes, and you can either buy, most of them don't sell dilators just one piece. Usually you buy them in a set. And so like a small set is going to have usually 4 different dilators, and the smallest one is about the size of a pinky. And then it'll go up in size. If you buy a medium size, you're going to end up having something that's a little bit thicker and a little bit longer. And then if you buy a larger set, your set is going to include much larger dilators. And so one of the things that you need to do is make sure that you figure out what size you're going to need. And so in order to do that, if your goal is to have penile vaginal intercourse with a partner, is to actually measure your partner around to figure out what size you need. And so that's actually one of the things that we recommend doing, just so that you make sure that the set that you get has the parts that you're going to need. But you also want to start off with one that is the lowest. Here's a couple other brands. The other one that I do mention is something called Millie. All of our stuff has been donated, so we're not vendors or anything like that, but Millie is actually an interesting device. So Millie is an expensive device, but this is all of your dilators in one. So it is sizable. So it's an automatic device where it expands to about this girth. And the length doesn't change, but the girth of the actual dilator changes. And what's really nice about Millie is that you can use an FSA, like your flexible spending account, or your health spending account, your health savings account, money to actually pay for something like this. I don't know if you need a prescription or just a note from a provider saying that this is a medically recommended material. And they also do have payment plans available for Millie. The other ones you can pretty much find either on their websites or you can find on Amazon. Amazon actually is a great resource for a lot of these things. They do sell Intimate Rose. They sell, I think, pretty much everything except Millie, because Millie has its own website. So you always want to start off with your smallest size and then work up to your goal size. And like I said, your goal size is based on what your goal is. If it's having intercourse with a partner, then you're going to measure your partner. If it is having an exam done, then you would probably talk to your provider about what size speculums they use and figure out what size they usually are expanding to and kind of work from there. If you are literally using a pinky and that is still causing problems, then this is probably as far as you're going to go for the time being. And then eventually you can work up, and that is our goal, is usually being able to get you comfortable with a larger size so that you can have your exams done. We have some average sizes on here. Average size of an erect penis length is between 5.5 inches and 6.3 inches. And the circumference around is between 4.5 inches and 5.1. And so just knowing those kinds of information gives you a little bit of guidance as to what type, like what size dilator to use. So I think it's important for making sure that we get this tissue stretched, mainly so that we can make sure that your exams are getting done to maintain your health. So with dilator use, what do we need? We need some space. We need some space and some privacy. That's pretty much one of the biggest things. I've had people tell me, there's no way I can do this. I can't find the time. I can't get away from the family and things like that. And I tell them, it's like setting up homework. Like you have homework to do and you need some time away. You need some privacy. So having that is really important. Having some time set aside. I usually tell people you're going to need somewhere between probably at least 15 minutes, 30 minutes would probably be better. You're going to need a good lubricant. If you're using a silicone base, usually the flexible ones are more silicone based. We would recommend using more of a water-based lubricant. If silicone is really what works best for you, then that's fine. I usually just tell people, make sure you wash all of your dilators really, really well when you're done. But a water-based would be better. But you're going to want a lubricant and then a lot of breath. A lot of this is actually about breathing exercises and figuring out how to relax the muscles that are in the pelvis. This is best done actually with the direction of a medical provider, like a pelvic floor physical therapist or occupational therapist. And so we do usually recommend, if you're going to do dilators, we do that in conjunction usually with pelvic floor physical therapy, which is really important. Now let's talk vibrators. Vibrators can be really, really helpful. Any type of vibration device to the pelvis is going to increase blood flow, which is going to also increase lubrication to the area. It helps to keep those tissues and get them erect, which actually helps with arousal. That can actually lead to pleasure. It can lead to relaxation of those muscles. A lot of the vibrators that we actually have in our office are considered medical devices, and they're actually used by some pelvic floor physical therapists to help with guiding muscles, to help with relaxation. Just if I had a knot in my back and I used a back massager, using that on that one specific spot would help to relax that muscle and break down some of the tissue that's making it really tight. The same thing can happen with vibrator use. So vibrators can be used internally and externally. It depends on the type of vibrator that you have. I have a couple of examples here by a company called Mystery Vibe, who does donate to their supplies to us. These are considered medical devices. When they can be used internally or externally. This one is more for some internal use. And then I have another one called Crescendo 2 that's actually meant to be used internally and externally. So they're actually moldable, they're foldable, which I find really interesting. So you can have internal stimulation and external stimulation at the same time. Let's let's see, they can be battery powered. You can plug them in. They can have, they can be rechargeable with USB cables like this one is. Some of them, they just have like almost like an aux cable, like your headphones used to have. And it might have like a little button on here. You just kind of have to feel and you just pop the thing in there and you can plug that into a USB charger. They also have a lot of different features to them. So when you're buying a vibrator, if you've never bought one before, they have different intensity levels. So they might have a low, medium, high. When you're talking about something like this, that's a medical device used for physical therapy, they actually have 16 vibration intensity levels. And then they also have a lot of different rhythms. So you might have a rhythm that's just a constant, bzz, or you might have one that's bzz, 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 or you might have so you want to look at those things when you're buying a vibrator. You want to see what type of features it has. Does it have a button that you have to hold for 10 seconds to turn it on? This will help when you have luggage. Things like that. You want to make sure that it doesn't accidentally get turned on somewhere. And so it has different features to it. So when you go to buy your first one, you're going to look at a couple of different things. You want to know what it's made out of. You want to make sure that it's made out of really good products, something that's not going to break down really easily. Is it silicone covered? Because that might indicate whether or not you want to use a silicone lubricant with it or not. You want to know those intensity levels, the rhythms, and different things like that. And also, you can also read reviews on a lot of these things about how long they last for people and how well the products actually stand up. Now, where can you find a vibrator? Well, online is probably one of the easier places if you are shy about going into a store. There are multiple stores in our area, though. We do have Show World, which has a couple of different locations. There's one here in Henrietta, down on Brighton Henrietta Town Line Road, just west of West Henrietta. And then there's another one down, I know, in Waterloo, across from the Waterloo outlets. They give me the shopping stuff, so I know where to find everything. And then there's also Medusa's of Rochester, which is a new store that's been there probably about a year, maybe a year and a half. It's right on Monroe Ave downtown. Amazon is a great spot to go. They have a great range of prices. They have a lot of different things, and you can literally go into Amazon and put vibrator, and that's it. It'll take you right to the right sites. If you're looking for lubricants or moisturizers, they sell almost everything on Amazon as well. So that's another spot to find all those different products. If you're looking for a silicone lubricant, just put silicone lubricant and it'll pop them all up for you. A Woman's Touch is actually a really great website that I usually show a lot of my patients, sexualityresources.com. A Woman's Touch is actually a store run by either a nurse practitioner or a doctor I think it's in Minnesota. But on their website, they have a lot of information. They actually have, and they have a store. So in the store, it'll say sex toys and aids. In the store, you can find vibrators, you can find dilators, you can find other like cock rings, you can find lots of different sexual aids. They also sell things like massage books and massage oils and things like that. But they also have a really great information section, and they have a whole thing on sexuality and cancer. So it's a really great place. They've got two spots like shop, and then they have education. Education actually has a lot of different information in there. Mystery Vibe is the company that I just showed you a couple of their vibrators. Dame.com is actually a really great website. They do sell vibrators and lubricants. Good Vibes is another one. Smitten Kitten Online is also another one. I haven't been able to check out Smitten Kitten because on a university computer, it won't let me in. But from what I understand from other people, Smitten Kitten Online is another really great resource. Now let's talk about pelvic floor PT. So this is a pelvic floor therapist. It's a physical therapist that specializes in treating the muscles, nerves, and connective tissues in the pelvic area. They actually are absolutely fabulous. They treat lots of different things from stress and urge incontinence, dyspareunia or painful intercourse. They do the dilator teaching like we talked about earlier. They also see women who are pre and postpartum. So they do a lot of work with women who are pregnant, who are having problems. They work with people who have back pain, pelvic pain. They also do a lot of things for post-surgery, especially in the GYN and prostate and abdominal world. We also here actually have an occupational therapist who works with us, and she works on putting the person, the occupation, which is what you want to do, and the context, which is where you're doing it and how you're doing it, puts all those pieces together and works on how those all interact. So they work with a lot of the different things that you're seeing here. So coping with loss of function. So if you've had a vaginal surgery and are now having problems finding out how to use that part of your body again, it's trying to help figure that out, working with maybe some movement changes or adding in maybe a pelvic wedge, like a wedge pillow that might help to sit somebody in the right position. If somebody normally has really great intercourse in a specific position, but now they've had a hip replacement, they can't do that anymore. So they need to figure out how to have sexual pleasure and work around those limitations. Activity modifications. If your energy level is pretty low, but you still want to have some intimacy with your partner, how can we monitor, like actually cut back on what we're doing, but still have lots of pleasure and conserve our energy? Sensation changes. That's another big one. I always remind people that 96% of sexual pleasure for women comes from clitoral stimulation, and the clitoris is outside the body. And so it usually isn't a part of the body that's as tender if you're having vaginal pain and pelvic pain internally with those muscles. So clitoral stimulation can be really great, but if you're having less stimulation in those areas or more problems with arousal in that particular area, then maybe we need to introduce something like a vibrator to get the blood flow down there, to increase the secretions down there, to make it a more pleasurable area. So that's what our occupational therapist works with. She's really great. And this is our team. Go ahead. I'll just keep talking. So this is our team. So you've met the three of us. Amanda Gable is our absolutely wonderful nurse extraordinaire. She is actually the patient's first point of contact if you ever wanted to get an appointment with us. The three of us are based out of the Kotula Cancer Center. We work with the breast cancer survivorship group, and then our sexual medicine is for any cancer survivor. And so our phone number is there. If you guys ever need anything, feel free to reach out. We kind of talk about pretty much the things that we talked about today is what we cover in a lot of our consults. Carli or Jocelyn, you want to add anything?
I think the only other thing that I wanted to add that I wish we had included in the presentation, now that I'm thinking about it, is a device called the O-Nut. A lot of times after hysterectomies, patients might have issues or discomfort with the depth of a penis or a toy that you're using. And the O-Nut is a vaginal bumper that prevents the penis from going as deep in the vaginal canal and can be really helpful after hysterectomies or other different types of treatments. So I recommend looking that up if that's ever an issue, or feel free to reach out and we can tell you more about it.
I can put the name of that in the chat as well.
That was just fabulous. I've learned so many things. And I just have to ask, is it possible for you to make these slides available to folks who would like to access some of the websites and different things that were mentioned?
It is. The file is fairly large, so I can't email it, but I can get it to you one way or another.
Perfect. I think that would be a really great resource for different people. And it was very well compiled. I've heard a few of them, but to see everything together like that was really impressive.
Thank you.
Very cool. Thank you so much. Wow.
Yeah, we learned things also.
Yes.
It never ceases to amaze me just how beneficial this kind of education is. And most of us don't have access to this kind of information. So I am extremely grateful to all of you for not only what you do, but for sharing your expertise with us, because it is hard to access. And there are so many social stigmas and barriers to accessing this kind of care. So for everybody who tuned in today, also extra gratitude to you for investing in yourselves, spending this little bit of time with us, because I know that it takes courage. So before I get emotional about it, I'm going to thank you all for being here with us. And I hope that everybody, if you have, I was kind of shocked that there weren't more questions dropped in the chat, but maybe it was just because you were also enthralling. So how about we'll take a few minutes, maybe we'll chat while people can, maybe come up with whatever questions they have, if they have any, and put them in the chat to share with you. Kristina, you'll be here with us next Wednesday evening, which is the 25th. At 7 to 8-ish, depending how many questions we have. So all the questions from all these Wednesday lunchtime seminars are going to be shared next week in the evening. We'll be together again. It will also be recorded, as we mentioned. So even if you can't tune in, which we hope you can still, that link that I put at the very top of the chat is where all the recordings will be.
Also, as you leave today, there's going to be a seminar, a survey that pops up on your browser. Feel free, there's a section in there for any questions as they may come to your forefront, and we'd be happy to ask those next Wednesday. Thank you all for joining us. This was just wonderful. It was great. I loved the tandem team approach here. I think that each of you lends a little bit different in your expertise, and it was just wonderful. Thank you so much.
Thank you so much for having us. I'm so happy we got to do this.
Yeah.
It was really fun, actually.
Absolutely. So send your questions in, and we look forward to seeing you next week. And the recording will be available on our website later today if you want to review. Great. Thanks everyone.
again.
Have a good day.
You too.
Take care.